are some high-risk behaviors associated with gang culture. And in clinical terms, in health terms, we don't really call them gangs. We call them peer relationships. So relationships that we form, and some of those are healthy and some of those aren't. So you remember, we'll go back to the 2011 riots that we had across the country. A lot of children were taken into police, and actually emerging evidence from that was that a lot of them had health problems. Some of them had substance misuse, and these remained unmet. So some money was set aside to look into specifically the health aspects of this, in which I was brought in. Now, we had to come up with something fundamentally different. We couldn't write a letter to young people and say, well, come and see me, my name is Dorcas, I'm a nurse. They just wouldn't turn up. The lifestyle, it doesn't allow itself, doesn't lend itself to following up with these traditional services. So we had to do something very different, and that's going to where they are. And that's what my job is about.
Were you not frightened? Because at the end of the day, these young people who are involved in gangs sometimes are trying to sort of find an identity for themselves, and often by having sort of safety in numbers, as it were, they have a bravado that they wouldn't necessarily have if they were an individual that you go and see. So stepping in there as a woman, going to see these young destabilised people, were you not worried?
And they are often called hard to reach, defranchised, all these sort of neighborhoods. No, I work with an amazing team, and this award really isn't really a Dorcas award. It's a team award. I work with an amazing team who are made up of all sorts of agencies who have a lot of information on what's going on. My role is to reach out using innovative methods. So it doesn't necessarily mean walking into a group of people and saying, well, actually, can I talk to you about, sexual health and substance misuse? We go out to youth clubs. We go out to prisons sometimes. I meet young people in cafes.
And is it an opt-in type of behaviour? So you turn up somewhere and it's up to them whether they want to engage with you or not?
Well, we have options here, and this is where persuasion and engagement is very key. It's very persuasive that if we take this route, you are more likely to come out of high-risk behaviors and high crime. If you maintain this route, you're more likely to carry on a disruptive route. So I've taken everything I can here from my previous experience, and I think that is really, really key. I haven't just landed in this role. The innovation really in my working has really come from my overseas work and my HIV work. My background, clinical background, is in accident, emergency and trauma ward, much of which I really, really cherish. Most of these frontline environments really bring out the best in you in terms of sort of engagement. So I had to take out all I can to really sort of engage with them. But actually, it's not, the hard work isn't really actually engaging. It's actually keeping them safe, and that's what we do.
These young people are very vulnerable. You mentioned mental health, and that can be in the form of many different guises. So learning disabilities, health needs, substance misuse, attention deficit hyperactivity disorder. How do you then continue to make sure that they are having contact with you and want to move forward? Because as you mentioned, it's not just about engagement, it's about longevity.
So it's about follow-up. How do we carry on that? If I see somebody first time, how do I make sure that we've got that contact? There are many, many persuasive ways which we use. This is not really just about Dorcas going out. There's a whole team of people out there who are terribly hardworking, who keep these families engaged, even when they're doing well. So we absolutely keep them engaged. These are not easy sort of systematic follow-ups that we say, when I'll see you next Tuesday. You have to work with their lifestyles and where they are. Sometimes the most innovative way is to actually see them when they're actually in a police cell, when they're on their own. You've mentioned a couple of health issues there. It's very important to identify that what brings young people in, what makes them more vulnerable, is actually that they have learning disability. It's very easy to end up in gangs when you're already excluded.
And is that because, this is me drawing a stereotype, is that because they've come from broken families, or are you finding that you also see people who are in gangs who are from well-off middle-class families?
It's very broad. There are many, many layers of factors that come into this. All sorts of education, all sorts of pressures, single homes, migration here and there. There are quite a number of factors at play. It doesn't necessarily follow, Asha, that if you come from a two-family home with two brothers in a very stable home, that you won't end up in high-risk behaviors. You and I have been teenagers. Everybody has. The idea and the need to follow and want to fit in is very much there, and that's what makes us vulnerable. So they're pulling.
My mother locked me in the house. I never had a chance to go and join anything. What is the best way forward? How do we try and sort of stop the next generation from falling into the same kind of pattern? What needs to be done? Because, you know, there's like nearly a fifth of girls in Westminster, for example, who are also in gangs.
A lot of work is already being done. I'm really, really proud of that. So many of our figures are much.
But what would you like to see done, bottom line, briefly?
Society looking out for each other. This isn't just a police job. It's not necessarily. We've got to absolutely instill healthy behaviours in our children, sexual education into young girls, and teach them to protect themselves. Teach them about consent. Young people can end up in all sorts of unhealthy behaviours because they're not clear about consent. Substance misuse. All the teachings that we leave too late until they're adolescents, that need to be brought way forward. So we need to really start early about talking about young children and their vulnerabilities. But we also need to pay attention to the fact that there are some families who are also struggling. And that's where
making sure the support system for families when they need help is there and not ignoring them.
And going to them rather than waiting for them to come. We have to have systems that are much more innovative than we have.
OK, Dorcas, thank you so much for coming in and well done on the award again.
Thank you very much for having me.